Schizophrenia is one of the most difficult mental illnesses to diagnose, which is one reason why so many people suffering from it fail to get adequate care. To make sure a patient with schizophrenia receives the most effective treatment possible, it's important to recognize the symptoms early and get a proper diagnosis. Doctors use three main categories to describe the symptoms of schizophrenia. Positive symptoms include hallucinations, such as hearing imaginary voices or seeing people who aren't there, and delusions, such as believing that you are under surveillance.
All of a sudden, I jumped up, the phone rang, I picked up the phone, and all of a sudden I just got real paranoid. I said, the phone is bugged, and I was crying and crying.
Negative symptoms include lack of emotion, difficulty taking care of oneself, and social withdrawal. A person will often appear flat or speak in a monotone voice.
Negative symptoms in schizophrenia refer to alogia, that is a poverty of speech, amotivation, a decrease in motivation.
Cognitive symptoms relate to problems with memory, attention, and understanding basic information.
People with schizophrenia have difficulty paying attention to stuff, being able to remember things that are said to them, have a hard time making decisions about things.
The severity and frequency of schizophrenia symptoms are different for everyone. They can be continuous or fluctuate over time. Onset can be abrupt or build slowly. Symptoms typically begin in women in their mid-20s to early 30s, and in men in their late teens to early 20s.
I first noticed I was really sick when I was maybe in my late teens, going to my early 20s, because I had left home when I was young.
The first time I realized something wasn't exactly right in a major way was in graduate school.
Many people with schizophrenia are often unaware that anything is wrong. Friends and family members are usually the first to notice the symptoms. Early warning signs of schizophrenia include a change in personality, appearance, or hygiene, feeling fear, anger, or indifference toward others, and a drop in performance at work or in school. If you notice these signs or symptoms in yourself or a loved one for 2 weeks or more, it's important to see a doctor immediately. But remember, arriving at a proper diagnosis can take time.
We don't have a lab test that says this is schizophrenia. The diagnosis is reached through talking with the patient, asking questions to family relatives, caretakers, friends.
A psychiatrist will begin by interviewing the patient, as well as family members and close friends, to find out what symptoms the person has and how long they've occurred. Diagnosis can be difficult because other mental illnesses, such as bipolar disorder, can cause similar symptoms. A doctor will also want to know about a person's ability to function, as well as any instances of mental illness in the family.
That's probably pretty likely that was the event that triggered it.
10% of those who suffer from schizophrenia have a parent or sibling who also suffers from the disease. While researchers believe schizophrenia is hardwired into a person's genes, environmental factors can often trigger onset. Your doctor will want to know if you've experienced any recent life-changing events, such as losing a loved one, moving, or even getting married.
It's in your chromosomes, and then add to that the right stressor at the wrong time, and the illness develops. Like, for example, kids that become ill with schizophrenia in college, that's a very stressful time.
In addition, your doctor will likely perform a physical exam and order blood tests or CT scans to rule out other medical illnesses which could be the cause of symptoms.
For first onset psychosis, someone should get a full neurologic workup, including a CT or an MRI, to make sure they don't have a tumor or some other kind of neurologic illness that could also cause psychosis.
Your doctor might also screen for drug use, as people who are intoxicated can sometimes exhibit symptoms of schizophrenia. To help determine proper treatment, your doctor will identify which type of the illness you have. There are 5 basic types of schizophrenia, though many patients can be grouped into more than one. Disorganized schizophrenia is characterized by speech or behavior that is difficult to understand, abnormal emotional responses such as inappropriate laughter, and visual or auditory hallucinations.
When I first diagnosed, the main symptoms were the voices, but these were female voices, so I know it couldn't have been me. And along with that, it was the voices, severe depression, isolation, not trusting people.
Those with paranoid schizophrenia have delusions of grandeur, such as believing that they have superhuman powers, feelings of anxiety or anger, and thoughts of persecution.
They may think that the outlets are placed by the CIA to plan their murder or kidnapping. So a paranoid schizophrenic primary disorder is their thoughts.
Symptoms of catatonic schizophrenia may include complete immobility or excessive movement, the inability to maintain personal hygiene, or a lack of response to people or situations. Patients with undifferentiated schizophrenia either do not fit into one of these types or have a combination of symptoms. And residual type refers to people who have had at least one episode and whose symptoms have decreased. Recognizing the signs, symptoms, and types of schizophrenia is the first step in treating the illness. And while a diagnosis of schizophrenia can be frightening, it's important to keep in mind that there are resources available to help patients and family members cope with this challenging disease.